Lauren Michelle Levesque, and I'm an assistant professor in the Providence School of Transformative Leadership and Spirituality. And I just want to thank you all for joining us today. So before we start, I'd just like to invite my colleague, Gabrielle Dupree, to do a territorial acknowledgement.
Hello, everyone. Welcome. We would like to acknowledge that St. Paul University is located on the traditional unceded territory of the Anishinaabe Algonquin people. We would like to honor the Anishinaabe, the first people of the lands and water of the Kichisibi, the Ottawa River Valley, from time immemorial. We acknowledge that the site of the city of Ottawa serves as the home of the Anishinaabe, as a place of spiritual ceremonies, cultural gatherings, and exchange among First People. Today, the spirit of peace and friendship is the foundation of relationships among Indigenous peoples and non-Indigenous people from around the globe. Thank you.
So I just want to say a little bit about the Being a Leader Lunchtime Conversation series. So this series offers opportunities to reflect with organizational and community leaders upon the challenges of social transformation in a complex world, and to better appreciate the resources that we have as individuals, but also as communities, to act within this complex world that we're living at the moment. So it's organized by the Providence School of Transformative Leadership and Spirituality. And I just want to start with a few reminders before we get to the conversation with our invited guest. As you can see, the conversation will be recorded and will be added to our YouTube channel. And we'll be sending out the link after the event. So if you'd like to, we'd like to invite you to keep your webcam open, but to mute your microphone during the exchange between our invited guests, Sahar, and our facilitator, Lorraine. And do not hesitate to send your questions or reflections through the conversation using the chat function. And we'll have some time for questions and answers following the conversation between Lorraine and Sahar. So at this point, I'll invite my colleague Lorraine to present our speaker this afternoon. Thanks so much.
Hello and welcome. So it is my pleasure today to introduce Dr. Sahar Zohni as our conversation partner. Sahar is the project manager for the National Newcomer Navigation Network. She has a master and doctor degree in pediatrics from Alexandria University in Egypt and a master of health administration from Telfer School of Management at the University of Ottawa. Sahar brings to her role over 25 years experience as a clinician, a lecturer, and a researcher, and also a passion for quality improvement. Sahar has worked internationally, including Egypt, England, and now Canada. Among her many clinical roles, she has been lecturer of pediatrics at the El Shatbi Pediatric University Hospital in Egypt, and as a pediatric specialist at the Nottingham City Hospital in England. She has also managed 2 highly intense units, pediatric intensive care and renal unit. Sahar has led many quality improvement projects along her years of practice, which she has brought to the Children's Hospital of Eastern Ontario, in roles in quality improvement and patient experience, including building the hospital's participation in the Solutions for Patient Experience program and a learning federal grant to develop a Newcomer Navigator toolkit. So with her leadership, the National Newcomer Navigation Network team has created a national network aimed at improving the experience of newcomers in navigating Canada's complex health and social services. So there's the big foundation, right, on which we welcome you to our conversation today, Sahar. And thank you so much for being here.
Thanks a lot, Lorraine, and thanks for everybody from St. Paul University and all the attendees today. Thank you. I'm really humbled. And it's a pleasure for me to be with you today. I just feel at home, right? Being in St. Paul, whether in person or virtually, it just since day one has been just your welcoming, your opportunities for collaboration for maybe 3 or 4 years now have been amazing. So thank you for this opportunity. Thank you.
Wonderful. Thank you for that, Sahar. I appreciate that. So Sahar, I've known you as the project manager, as I've mentioned, of the N4, the National Newcomer Navigation Network. And my experience of your leadership in this very important venture shows that you are intentional in wanting to make a difference. As I mentioned, even in the intro, that you're really intentional and have a passion for what we refer to as quality improvement. And in this case, of course, in wanting to better the newcomer experience in Canada. However, I do not want to start our conversation there, as I realize that your current work is situated in a longer journey of leadership in which you have been instrumental in transforming healthcare systems in both Egypt as well as in England. So can you tell us a little bit about that journey and how it has shaped your leadership today?
Thanks, Lorraine. So I think it goes way back when I was just, doing my residency at Al-Shadbi University Hospital in Alexandria. I just worked closely with lots of the families and lots of the children. So my subspecialty is in pediatric nephrology. So that's, concerning the kids and when they have renal or kidney diseases, right? We had a unit for dialysis. We had a program for lived donation, right? So it was really an eye-opener to look at that and see the limitation of the resources, right? Although it's a university hospital, but still there were lots of limitations, right? So there were things that we knew, like as physicians, as we had the guides, we had the protocols, but we couldn't implement them because it was like, either the machines for the dialysis were too old, or the system, the collaboration system with others was lacking. So I always asked those questions, or I had those questions in my mind. Could we do anything different, right? So, and it's hard when you're a junior physician, right, in a hospital where there are professors and there's, it's part of a university, right, to ask these questions. But I think these questions kept on, just building inside me, and just seeing, at the end of the day, it's the child, it's the family who pay the price of not getting the, the full treatment or the appropriate treatment, right? So I would say that has always been in my mind, right? And I always questioned, should we have more resources for healthcare? Should there be more collaboration or advocacy for, bettering the systems that we work in? And then I had the opportunity to finish my master's in Egypt. And then I got a scholar to go to England in a very, I would say, eminent unit there. So it's in Nottingham City Hospital. And there I learned that, yes, you can change, you can change reality if you want. You can change the lack of resources. You can advocate on behalf of your patients. You can open the doors for volunteers to come in, because volunteers or the principle of volunteers was not, at that time in the 80s was not there, in the 90s, sorry, being too old, was not there in my hospital in Egypt, right? So besides learning all the clinical and finishing my MD there in England, I was, and of course, given the opportunity to practice and have my own clinic there, I worked with a very eminent consultant who really had that idea of quality improvement, who always had that eye on how can we do better, right? How can this unit, when you look back in 10 years and look at the unit and say, oh, we've added, these resources, we've added, those supports to our patients and to our children, right? So I learned from him a lot. He was very challenging. So beside teaching me a lot and really being a mentor, he also used to always challenge me, right? And it was, but Dr. Zohni, you can't do this without, changing, that, or what I mean, or and usually it was like system changes he was asking for, and I was like, okay. So I used to go home with all these ideas of how can I make this even, you know what I mean? How can I even advocate on behalf of that? And I decided to go back, although I got an offer to stay in England. I decided to go back after 2 years and take on his challenges. So that for me was like, so fundraising, for example, was never on my radar, right? Or the radar of any of my my colleagues in the hospital. So I just brought it, to our whatever committee I was allowed to sit on or discuss that principle. And to my pleasure, maybe after 1 year, it was, yeah, we can definitely, adapt that idea of fundraising and allowing volunteers to be, a part of the hospital. And volunteers brought more fun, more sponsors, right? Because some of them even became sponsors themselves. So yeah, I mean, like that was for me was I would say a change in my life, because I realized, yes, besides, you can dream big, you can really, go through a lot of research and advance a lot of your clinical skills, but without the resources, without the buy-in from your from senior management, from political even, some of it was political, you really can't change. At the end of the day, you can't change the services you're providing to your children, to the children, or to your patient, right? So we were able to change the unit. We were able to fundraise and a huge amount of money, I would say, at that time. And lots of our machines, the dialysis machines, we were able to change them. We were able to create like a stream for collecting funds, through the university itself. Again, we're able to hire a full team. So we didn't, it really, the practice all depended on us as physicians. So we were kind of, multitasking. We will be the social worker and the nutritionist, right? So that's another thing I learned from him is you can't do it all. There has to be others, right? You have to let people in, and it doesn't have to be, it doesn't really have to be a tailored practice. You can create what really works, for the community you're in. And that's what we did, at my hospital. We just, hired a nutritionist, we hired a social worker, we allowed the youth to come in. So that for me was an eye opener that, yes, if you want and you just propose the idea and just, it gets a good response from the people around you, and it gets a buy-in. I had amazing professors who were supportive of the ideas brought back to them. So yeah.
Wow. So it didn't just happen on its own, obviously. I mean, there was a real intentionality about this. And it sounds like, when you say it started like with a dream or with an idea, it also sounds like it started with you're really attending to something's not quite right here, right? There's something missing. Patients, right? Families are not getting the care that they really need and that they deserve. It's really, it sounds like it's from there, right? That kind of was your catalyst. It also, as you tell that story, also, I think, demonstrates the importance, right, of calling in the resources, right? Calling in amongst your own network in order to grow that. But does that capture a little bit about what it is that you've lived in that experience?
Yeah, I think so. It's always that nagging, that nagging idea when I was a resident. can we do better? You know what I mean?
Yeah,
Why are we
yeah.
doing this way, right?
Yeah.
And it always
Yeah.
trickled to, there is lack of, resources, whether it's human resources even, right? So why are we sending, or we used to get, we served as a hospital, as a university hospital, we served like 4 governances around us. So we would have patients come to the dialysis unit 3 times a week, and they would have to travel like 4 hours, right, each time, 4 hours to come into the unit and then 4 hours to leave. And for me, that was like, why are we, why don't we have units, in those governances, right? Why are we, exposing our families to this type of stress, even when we had the revolution in Egypt in 2011, we still asked our families to come because there was no dialysis unit, right, where they were. And as parents, they were irresponsible for that, right? So I mean, like, it's always felt, it always sat very heavily with me, because I felt like, should we be moving the service to them when it's, is there something that we can do in the system to do that, to change that? And that was one of the things that I really tried to bring up one day, talking about, how much traveling should a family do, right, to get a regular service for a child, right? So that was one of my big fights.
Well, it sounded, and you were successful at having them have the units back in their governances.
That happened just with COVID-19. So with COVID-19,
isn't that interesting? Okay.
Yeah, with COVID-19, I was really thrilled to hear from the Minister of Health, Deputy Minister of Health's office. They just came back to us and said, we think it's unfair for those families to travel. It's unsafe for them. So we remember a proposal for or an idea that you had one time, right? Not my, just I was part of that team, right? So and I don't know, because of COVID, things were looked at again. So, and during COVID, we really had a satellite unit in one of those cities, which is maybe 4 hours travel from us. So,
wow.
Yeah.
So it sounded like you certainly, even though you weren't there when it happened, because you're here in Canada now, but you certainly had planted those seeds to make that happen. And,
I hope so.
Yeah, but it's also my understanding, Sahar, that you're still involved there. So you do the watering of the seeds, right, from Canada into Egypt now. Yeah,
I was really, thrilled to hear from them, and then we piloted this over the last few months, and with 5 other very eminent physicians there, so my colleagues, and we were able to start a satellite unit or a small unit in an adult hospital. So already an adult renal unit was there, and we kind of tapped into that and said, we will get our own machine, we will get our nurse and the physician and everything, we'll follow the patient. And yeah, there were stresses, of course, there were nights when it was super stressful, but I would say we just, persevered, and I think it's being evaluated if they will have a permanent satellite unit there.
Interesting.
So hopefully, let's keep our fingers crossed, and the COVID-19 had a good impact on those families. And
yeah. So you said an important word in all of this too, is we just persevered, right? Because perseverance sounds also like an important quality, right? That you've had to, we can say that you, not only do you have, but you've actually had to engage, to exercise, right, in the kind of leadership that you've been about. So I'm thinking perseverance, persistence, right, because there's also that. But I also heard we had to be patient. And perhaps you didn't say the word, but it sounds like also there you are planting a seed, but something comes out later. Can you say a little bit about how those qualities are helpful? You say for your own leadership, but I would say leadership in general, that really is about bettering, right, the system, or the kind of improvements that you're talking about.
I think it's just out of, there's nothing, if you have done everything you can, right? And this is what we usually do, all of
Yeah.
us, right? And wherever we are, we just try our best. You know what I mean? And then there is a time when you just have to be patient and wait and move on, right? So I think that's how it has always been for me personally. It has always been, have I done enough? And you know, is everything that needs to be there, it's there, it has been, you know, addressed, and if so, then I don't think there's anything more other than to be patient. So that's how it, you know, I think it's through even, you know, practicing medicine, you have to be patient, right? You have to wait for the results, and just to the same for any, you know, engaging senior leadership, engaging, you know, in any project. You really have to make sure that you have done everything, and then just be patient.
Yeah. It calls, right, for that, also that sense, that inner confidence, right? Knowing that you've done, like you say, everything that you can, and hopefully, right, it will, the outcome that you're hoping for will. And yet patience is not something, right, easily come by. We certainly, in my own experience, I would say I need others to help me be patient and to remind me, right, I'm not going to get that along the way. I'm wondering, you know, in the midst of all of this, you know, what have you encountered, we can say, of traps or potential dangers, right, in your attempts, you can say, to be that catalyst of change, to be able to bring forward, right, the changes that you know are needed, that you see are needed, but not really sure even exactly how that's going to work out? What might traps or potential dangers be?
I think it's maybe being, you know, unaware that people have to be aware, first of all, right? Like I feel it's just the knowledge, sharing the knowledge, and making sure there are no assumptions there, right? And just being clear in the information you're giving, right? And sometimes if you don't know something, just say, I don't know.
Yeah.
Or we haven't tackled this yet, or we need more time, right? So I just feel that sometimes is you know, was a trap. And I'll just give you an example. We were offered back in Egypt again, we were offered to have a center for just renal diseases in Alexandria. So we were kind of offered, you know, a piece of land, and it was up to us, you know, to the hospital really to fundraise for that. And because there were lots of restrictions and lots of regulations from the university, right? Everything we proposed got, you know, they just denied everything that we proposed, right? So I when I look at it back, and I feel, oh, you know, if we had first brought awareness, if we had asked for more, you know, for maybe more meetings where we kind of discuss this, you know, instead of just dealing at that time, it was like letters and emails, and you know what I mean? It would have been much more appreciated, right? So again, having, you know, some political will at that time, maybe we would have made a difference, right? So I always feel that, you know, first, you know, you have to have but again, walking into this as a physician, maybe lacking the tools, right, for advocacy at that time might have been a trap.
Yeah, well, well, because of course, physician has a very particular training, right? Advocacy is all other kinds of training. And so here you were being in a situation where you were now looking for these tools. One of the things I've heard you say in that is that, you know, we come into this with all kinds of assumptions. And so how I'm hearing that is that unless we open up, right, those spaces for dialogue to put our assumptions out there, we're kind of, is that kind of what you lived? Is that what you see?
Yeah, I think so. Yeah, and it was very apparent with the N4 project, right? Like with the N4, right, with the national thinking of, you know, I think we like I was very lucky to, you know, to be part of CHIO and to work with Christine Coury, manager of health equity and diversity at that time, manager for patient experience. I learned a lot, right? Just being there and just observing dynamics, observing, you know, the how we deal with the immigrant families, refugees as a children's hospital, you know, with all intentions, trying to do the best for them, right? So, you know, that observation and that awareness, I think, right, just before then dreaming, moving to the dream of having, you know, that that network, right, was really very helpful, right? It's very important to really observe and learn, and, you know, and then bring that awareness and bring all you've observed to the to senior leadership and to the funder, or, you know, when you're looking for funding.
Yeah, the observing is a really important piece, as you say. And observing certainly isn't just passive looking upon, right? So again, you're bringing a quality of attention to your observing, right? You already have a purpose. Can you say a little bit about what was the purpose? How you were attending to what you were observing that has now, we can say, grown into this big network?
Being with, you know, for maybe 3 years, you know, being with patient experience and then with the quality improvement team at CHEO, you could see that, you know, Christine adapted quickly and to the Syrian refugee and the influx of Syrian refugees, you know, in 2016, and you know, hiring a newcomer navigator specifically for that position, and then increasing the funding for the interpretation, you know, as a hospital, hiring more interpreters who spoke Arabic, right? For me, all these were like, you know, the right steps, you know, to provide better service, right? And to support, like, you know, patient experience, supporting the whole hospital at that time, you know, still is, of course, and supporting the staff. So I always looked at the staff and I was like, oh, you know, the staff needs that support. The staff needs the knowledge. The staff needs to understand the culture of the immigrants and refugees. They need to understand that the hospital as a whole is behind them, right? They're supporting them in what they're doing. And I always looked at that model and I was like, okay, you know, is it repeated across the country, or is it not, right? And when I first started with CHEO, I was like, that model, you know, had the opportunity to be, there was an approach from the government to say, you're doing a great job by having that newcomer navigator program. Can you write it up for the whole, you know, for the whole country? And this is where, you know, I work with Christine closely to put together like a tool for other organizations to really try to mimic the model that she had, and CHEO really supported, right? And by doing that, I felt, oh, we have an opportunity here to share, you know, a model that worked for one hospital. So why don't we mimic that, right? Why don't, you know, all the organizations look at adapting that model, especially that, you know, navigation, our system navigation is not new, well known in the in medicine, right? Like there are system navigators that work especially with patients who have chronic diseases, especially in oncology and diabetes and so on. So that was published, and it was part of, you know, the work that we were very proud of, simplifying the journey. And it really, at the end of the day, it depends on the uptake of the organizations. Would they take this model? Would they adapt it? Would they, you know, use it or not, right? So I think we waited and waited to hear, you know, on the feedback, you know, while presenting it during conferences. You know, we always kept an eye on, you know, are you using this model? Are you hiring, you know, are you setting your hospital? Do you have a newcomer navigator? Do you have sessions of even, you know, sessions that you know, increase the knowledge of your staff about the culture of immigrants and refugees, and what does that journey mean, right, to them? Yeah, but that was the I think this was the trigger for us, you know, to even go, you know, oh, we think maybe we can have a national you know, network out of those professionals who serve the immigrants and refugees.
Wow, it sounds, certainly replicating in many ways, right? That whole leadership, right, that brought to in your original hospital where you were working about. Again, it's about gathering the people, but also what I'm hearing is that in this particular case, proposing a model, right? A model that has worked well within your own setting, and hoping to see that then to be at the service, right, of bettering that experience across Canada. Yeah. So the strategies then that you might have used and the resources, right, that have helped you to make that change happen now for the national network. Can you say a little bit about that?
I think one main component of the, National Newcomer Navigation Network was really finding those, learning opportunities. We found that, it's easy to say, I have the language, I know the culture, but do you have the knowledge? Do you know what does it mean to do? Are you aware of the immigration laws? Are you aware of social justice? Do you know what's conflict? How to support the families who have disabilities, right? So that's where I think, again, going back to, Christine had hired a newcomer navigator, but did she have the knowledge? No. Yeah. And this is where I think both, myself and herself, we aligned in that idea of we need that education component, right? We need that. We need to reach out to a university that can provide a program, right, that really provides those professionals with the knowledge they need, right? And this is where I think we started calling, and at that time it was a dream. We didn't even have a program, right? We just had that idea or that need, let's put it that way, of that we really saw, right? And calling around universities across Canada, trying to get the buy-in, when we had the proposal, right? We were just, preparing to have the proposal and submit it to the government. And everybody wants concrete ideas. They want, what's the ask? Until we had, we tapped into St. Paul University, and I always say, it's just aligning the right people who has the right intentions, who are just dreamers like yourself, right? So here you are, you're meeting with a team that didn't ask a lot of questions, but just got into the dream of, oh, let's have a program, let's design it. It will be used by, or it will host all the professionals across Canada. So I mean, it was just, I think it was the that passion that I felt when I walked into St. Paul University, right? From Chantel, Michael, everybody, right? And yourself, Lorraine, you yourself were like, I think you wanted to ask the hard questions, but you didn't.
Oh yes, I did, but not there.
Initially, you did that.
That's right. Oh, isn't that interesting?
Yeah. So I mean, again, it's that alignment, it's that awareness, it's that I think it's just it's very genuine, right? For me, it was like a unique, again, another unique model where you have a hospital, a pediatric hospital, trying to with the partnership with St. Paul University to just build a program for students. And COVID-19 proved that we were right? It's online, it's a 12-month program, it's online, it's the skills and the knowledge that our professionals from across Canada learned, the use of those skills in their everyday life when they deal with immigrants and refugees, the changes in practices they're trying to implement, their passion to sit on committees like equity and diversity committees that we're hearing about is just amazing. And I think it will affect their organizations, definitely. That's the hope.
Yeah, no, I appreciate that. I also like how you brought it back to me. This is very interesting, very smooth. What I do want to say in all of that is that And I think there's something, right, for us all to learn, right, as leaders, you know, in leadership, where we really see our call to change, is that it's okay not to have it all nailed down and have the answer, right? It's the knowing, right, that something needs to be fixed, something is needed here. To dream it together, to see the possible together, and to build it together. And I think that, you know, the leadership that you bring and that you have brought over time, you know, demonstrates that really well. And it is about opening up those spaces, right, for the good conversations that need to happen, so that there's a bigger clarity that comes to that. Yeah.
And I think it's working with the right team.
Well,
so
yeah.
I've been all my life, I think, blessed to work with the right team, right?
Yeah.
So, you know, practicing medicine, there was always that passion, you know, there's always the patient comes first, and, you know, the families, the support we provide to our families really, you know, talks to the wellness of our children and how their journey with illness ends up, right? So then working with the N4 team, right, was again another opportunity for me, you know, to really, they bring a lot, so open to dreaming and to executing a lot of those dreams, and then having the right partnership, right, the right team again from, you know, from St. Paul University, the support we're getting from CHIU, you know, as Christine always says, it's a children's hospital that adapted a federal, you know, project that really is not pediatrics, right? But at the end of the day, it will support the pediatric system, right, or the health of the children who come to Canada as immigrants and refugees.
Beautiful. Sahar, I would love to go on and on. This is so interesting. And I know that the clock is telling me that I think what we'll do now is that we're going to hand this back to Lauren, and Lauren's going to open us up now for conversation. Thank you so much, Sahar.
Thank you, Lorraine. Thank you.
So we have about 15 minutes for questions from the participants. So if you have any questions, you can use the raise your hand function in Zoom, or you can just, you know, signal to me, and hopefully I'll be able to maneuver around the screen to make sure that I get everyone's questions in. So the floor is open if anyone has any questions. Yeah, it looks like Bianca has a question. Go ahead, Bianca.
Well, thank you very much, Dr. Zohni, for sharing with us your experience. It's been such a learning, listening for me, and I wanted to. I think what I want to say are one comment and one question. So the comment is, I find it very interesting how the international experience that you have, and I'm talking from my own experience as well, is that it opens these realms of possibility. When we see that things can be done differently in other places, it makes us, you know, see something that maybe we were not able to see when we were in a certain culture and in a certain environment. So I find that very interesting, how you were inspired by your studying in England and how you went back with these new ideas. And this was a comment, just as a reflection, that I found very interesting in terms of the creativity that comes with that experience. And the question I have is, how did you convince people to give their time to this learning experience? Because a lot of people are so busy in their jobs, you know, and when they hear about transformation and about the need to new things, you know, they all use that and for a good reason, you know, the fact that they lack time. So how were you able to, you know, inspire them to give their time to the learning?
In general, I think it's about, you know, just engaging them, right? And I find that, you know, although people are busy, right, there is always, if you tap, or if one word or one initiative or, you know, one idea or one dream aligns with something in their, you know, and something that they wanted, or, you know, a possibility or a possible, you know, maybe dream that they had themselves but weren't able to, right? That for me was like, you know, it sort of empowered them, right? To like some of those meetings would be, people would come in and they're very silent, right? And they wouldn't share what their thoughts are. And then maybe the second meeting and the third meeting, they become this spokesperson, right? They just, you know, tell you what they think or how it aligns with how they would have been thinking, or share sometimes even, you know, that they have tried and they have failed, right? And with this, I think these initial conversations are very important, because if you give them that opportunity, if you feel that it's okay, we can fail, we can, you know, we can dream and not get there, right? But at least we're talking about it, right? And I think that's very important. That's what I found, like, you know, just keeping the conversations and making sure, you know, the silence in the room changes to some positivity sometime, right? That has been my personal experience with, you know, giving opportunities for people to really, you know, express themselves, and everyone has something to share. You know, even if it's an idea, sometimes people would share and say, I don't have the time, as you're saying, Bianca, but I can give you advice, you know, and I'll just hop on a call with them over the phone and just get them, you know, to give me that advice, or, you know, or ask them to maybe keep an eye on a work that I was doing or the team was doing, and just, you know, give us an evaluation, or give us a critique, if you may say, and how to, you know what I mean? And it's not up to them even to suggest a change, right? But just the critique itself was really what we needed, right? So I think that has been my personal experience, Bianca. I hope I answered your question.
For sure. Thank you very much.
Does anybody else have a question for Sahar? Yeah, Ben, please go ahead.
Yeah, thank you for sharing your passion and the amazing journey that you've had all across the world, and sharing that your enthusiasm with me and everyone here. And I want to get you to go up to northern Quebec to help get them some dialysis machines in their communities. So they have to send their patients to Montreal, about, I don't know, 1,000 kilometers away, and their patients have to leave the community, live in Montreal for months, years away from their homes, just so they could be by the machines. So anyways, that's just a thought for you. Anyways, my question is, you talked about in the 4N work that you've done, the need for this educational component, and it seems to me like it's something that had to be thought of and dreamt of and offered like on a national level. And I think I heard something like you guys creating a 12-month, you know, program to offer training. So how did you guys think was the best way to do? How did you end up doing that component?
I think I'll turn it out to Lorraine to talk about how. How did we do that, Lorraine?
I was looking to see on the screen if perhaps Matthew was here, because Matthew certainly, well, I think the very first thing is that she rallied the troops, right? And she inspired us, and she made us believe that we could go forward. And in fact, there's several people on the screen today that were all part of those initial meetings. There's our rector, Chantal Beauvais. There is Michael McClellan, who is our Secretary General, who just supported us all the way. There's Pauline Bélanger, who was here. So rallying those troops, right? And also helping us believe that we could do it, even though we didn't have the final product, that we could trust that we could get there and ask the right questions. I think that's the big thing too, right? Sahar is asking those questions, but why don't we open that up perhaps to others that I have named, and perhaps others also that have been part of that, to see how did we get there? How did we get there? Okay.
Do you want
Go
me
ahead,
to-
Colin. Yeah,
Okay.
go ahead.
Well, if I recall well, we started off, it wasn't even supposed to be a credit program. It was supposed to be like a non-credit program. We were just supposed to start with courses, and we weren't even sure how we were going to do it at the beginning, but it was for sure that we weren't going to go towards a credit program until we realized if they're going to take all these courses and do all this work, they're going to want something in return. You know, the students are going to want to have something to prove that they've taken these courses. So we got into thinking maybe we could create micro programs, and even the micro programs are not a university official degree. It's indicated on your transcript, but it doesn't go anywhere after that. And then we realized, well, why don't we take micro programs and have them turned into a certificate, and that becomes a university degree. So from talking to people and to, you know, the faculties are involved, and we bounced back and forth and talked about how we're going to offer it, how long should it be, how many hours should it be. These people were all working. COVID hadn't hit at that time. We had no idea what was going to jump out at us when COVID hit. But yeah, it was a really nice experience to work on something like that, and so fast, to do it as fast as we did.
Yeah,
So
it's great.
Any other questions or comments?
Well, I'll add one, and is that, and it meets exactly what Sahar was saying earlier about when you do see this possibility and want to make it happen, it's the insistence also on resources that so you need to also be realistic, right? It's one thing with the ideal and the dreaming, but you also, right, need to bring the realism of having adequate resources and adequate funding in order to make it happen. So it's the intentionality, right, that we brought to it. And I think, Sahar, that speaks a lot to how you have done that, you know, throughout your own leadership. Yeah.
Thank you, Lorraine and Colin. Chantal, did you have a comment related to what we were speaking about? And then I'll go to the ask this question in the chat.
Absolutely. The three things that struck me in Sahar's testimonial is that one key element is generosity in listening to one another. So from both parties. So when you did a project, you were welcoming criticism, new ideas, things like that. You were expecting it, as a matter of fact, and you are so very zen about it. And also, when we welcomed you at St. Paul's, it seems that we were able to provide also that space of generosity in listening. From experience, I know that, for example, I wanted to partner with another university, and the first questions they asked when we got into the room is, what's in it for us? So it was kind of a damper, you know? So I think that to suspend all these questions and just be there and listening to people. And I think that's the other part of your, what you said is about dreaming with others. So I think to generously listen leads to dreaming with others. So we were enthused by your project, and we just, you know, we just wanted to dream with you and be part of it. So, and the other part is the comfort with uncertainty. So Lorraine mentioned it, and I think you experienced that as well. Often with universities, but other types of institutions, we feel very uncomfortable with the unknown, and so we want to have everything figured out, and we don't want to take any risks. And often programs and initiatives don't get done because of that. So I think you are definitely comfortable with risk and uncertainty, and I think that's communicated with others around you. So thank you for sharing your passion and leadership.
Thanks a lot, Chantal, and it's and thank you for dreaming while our eyes were open, right? Like it's hard to dream, right, with open eyes. So this is always how I felt at St. Paul. Like, you know, you're willing to dream, but your eyes are open. You're listening, and whatever we brought back to you, right, from our, you know, from traveling, doing the site visits in person, and bringing those live experiences of who would be the students, right, taking these programs, was very well received. I think it was a, yeah, I think it was just a believe in the dream, right? So thank you.
So Asta has posted a question in the chat that I'll just paraphrase. So she was asking, when working or being in dialogue with governments towards systemic change or in terms of funding, did you notice any common arguments or perspectives that hit home with the powers that be, and hit home in the sense of opening their minds and their hearts in terms of being present to your projects, your initiatives?
I think we were lucky with this proposal that we went for. Like the type of funding that we were under was, you know, the service delivery improvement. So I think we hit the right funding in the sense that the government really wanted, you know, new ideas that would prove concept, right? Like we will, you know, we had that idea of building that network, providing the education, providing opportunities for, you know, further even, you know, education through our platform that we built for the N4 platform, and they were like, you know, this is new, you know, and they are so used to maybe funding, you know, smaller projects and ones that really concentrate on the settlement sector. So here we're coming with this, you know, concept of, or idea that we can do this bridging between the healthcare and the service and the social services sector, the settlement sector. So for them, it was a new concept, right? And it fell under the new, or the right funding, I would say. So I think that the now it's going to be the challenge. We've had the proof of concept, right? It's now to move into making this program available, because I always remember at one of the focus groups, one of the students, the candidates, he said, or she said, she said that if everybody working with immigrants and refugees had this type of education, the 12 months program that St. Paul University is offering, this would make her life much easier. So imagine you're like, you know, you're a physician or a nurse, and you know that you're going to be dealing with, you know, when you deal with others, right, in the same field, you know that, you know, you had the similar education, you're talking the same lingo, right? So by having that testimonial from one of the candidates who took the program, I wish we will be, you know, heard by the government, by, you know, and they will really appreciate that this type of education is necessary, it's crucial. You can't hire settlement workers, you can't hire social workers for hospitals, and you can't hire Swiss workers, you know, in the school boards to deal with the settling, you know, and providing care for immigrants and refugees without them having the education. It doesn't really make sense, right? So it does not align with, you know, what we have been always, you know, talking about, and I think it makes us even waste a lot of resources, right? Because by not knowing their needs, by not knowing, you know, what to expect, or the services even we're providing them, is it adequate, is it not? With the COVID-19, we found out that there was lack of data, right? Like lack of data about a very vulnerable population, right? So by having all these, you know, barriers to provide those services, I just feel that, you know, I wish we will be heard, and I think now is the challenging time.
Thank you so much, Sahar, for your responses. So we've come to that time where I get to thank our invitee. Thank you for sharing your passion and talking about dreams and the idea of dreaming together. Thank you so much for sharing your experience, and and just your insight into the work that you do, and also into leadership itself. So I just want to say thank you to everyone who's joined us today. We really appreciate everyone's participating in this series. And I just want to mention that we have an upcoming event in October, and we'll be having Bakra Monai, who's Commissioner Bureau de lutte contre le racisme et les discriminations systémiques at the City of Montreal. So we look forward to seeing you all again in October. And once again, Sahar, thank you so much for your inspiring talk.
Thank you very much. Thanks a lot. Thank you, everybody.
Thanks a lot, everyone.
Thank you.